Good afternoon, ladies and gentlemen. We bring you greetings from Richmo Media, health issues to your doorsteps. Today is another brightest day, the greatest day that the good Lord has given unto us. And as we all wish, is the will of God that we all have good health and perfect health. Same way is the wish of Richmo Media Health Issues that all our viewers, all our listeners within the globe and around anywhere that you can hear us or view us also have good health. So today we have planned on another health topic that we want to discuss this afternoon. Fortunately, this month too has been designed for breast issues, breast cancer awareness, creation, and its prevention. But good news is that Richmo Media, we love our viewers and our listeners. So due to that, whenever there is an issue concerning health that might affect our viewer or listener, we try to discuss it so that we will create the awareness for us all to get the overview of it and to have the knowledge about it. So this afternoon, we are going to discuss something about how to maintain the health of the breast. How to maintain the health of the breast. And when we talk about breast, we know that always when they are talking about breast cancer, the focus and the attention always goes to the females or the women. But men also have breasts and women also have breasts. But at the end of our presentation, our guests will help us to be able to dive deeper on how we can maintain the health of the breast. So we will invite a special guest, and fortunately, she's also having breast, and she's a female, and she is specialist in breast. So anything concerning breast this afternoon, we will be able to know. So invite Sister Dorcas to join us so that we will have our discussion. So Sister Dorcas, good afternoon to Richmo Media Health Issues.
Good afternoon, Mr. Ackon. Okay.
I believe by the grace of God, you are doing well.
Yes, please, by God's grace.
Yeah, Sister Dorcas, I believe by the grace of God, you are doing well.
I'm doing very well by God's grace.
Yeah, we thank God. So our viewers and our listeners across the world, this is our guest, Sister Dorcas. And in short, she is going to take us through today's presentation. So, Sister Dorcas, what should our viewers and our listeners who are listening and viewing you, what should we expect within this presentation? Thank you.
Thank you. Good afternoon to our viewers, our listeners, those streaming from Facebook, on YouTube, and every other social media handle. We are grateful that you were able to join. And we are presenting on how to maintain the health of the breast. As we know, is a pink month, is Breast Cancer Awareness Month, where we create awareness on breast cancer. So this afternoon, you are going to hear how to care for the breast through puberty to postpartum in the women, and then the men also. You know that men also get breast cancer. You have breasts, you develop breasts, and so we are going to learn it, know how to self-examine ourselves, know how your breast is so that you can identify anything, because hashtag early detection always saves lives. Thank you.
Welcome. So that's why I want to wear pink, and I know your colors to pink is within because we are in the pink month. Thank you. So can you please take us through some overview of the breast? What we've been hearing, breast. So is it what we are seeing alone that's called breast, or we have some things to look out for? Thank you.
All right. So when we talk about the breasts, as you can see on the screen, the breast is made up of a lot of things. We have the lobes, we have the ducts, we have the nipple, and then the women have areola. And then on the image, you can see that it extends where it extends from. So some people think that it is just the projection that is the breast, but actually it extends from the clavicle through to your armpit down to the second rib. So that is how the breast is formed, and it is mostly made up of fatty tissues. It's made up of fibrous tissues, and then um, is also made up of glandular tissues, made up of a lot of glands. That's how come during lactation, when a woman is breastfeeding, the breast is able to produce a lot of milk. And in the male and then the young or immature female, they are very rudimentary. It means they are not well developed. But then in the female, the breast develops by puberty. Everybody's breast is fully developed in the female. Now, the breast is also called the mammary gland. So sometimes if you check, you may not see the breast, but you can also see the mammary gland. Okay, so um, let's take a few statistics about the breasts or breast cancer. And the reason we are talking about the breast mainly is to detect things early, have the right diagnosis, and then the management would be quick, and then deaths are also reduced. So when we take globally from the world, about 685,000 people lose their lives with breast cancer. So that's the statistics from World Health Organization just last year, 2023. About 685,000 people lose their lives to breast cancer. Then 2.3 million are newly diagnosed most of the time each year. Then we have 7.8 million of women alive with breast cancer. Jesus. Um, the World Health Organization, that is where we have a lot of information from. And then we are saying that we can prevent about 2.5% of this occurrence. And that is the main aim of this awareness, that through advocacy, through creation of awareness, we can reduce the incidence. And we are hoping that by 2030 to 2040, we should reduce the incidence of breast cancer death by 40% in women. Then we are saying that 7% of all death from cancers are caused by breast cancer. Then when you take the female, 15% of death from cancer each year, and this is so appalling. And it is the second most common cancer in women with the statistics from the UK. I hope we have viewers all over the world. And so with the statistics, I'm sure that we are going to help eradicate it. Then we are saying that 85% of cases occur in women with no family history. So actually, it doesn't mean that when you have a family history of breast cancer, you are the only people at risk of it. 85% of cases do not have a family history. Then we are saying that 90% of these cases, when detected early, are able to be cured. So, and then most of these breast cancer cases also, some of them do not present with symptoms. So if you do not know your breasts, then it's a challenge. Now let's go to sub-Saharan Africa, the data from sub-Saharan Africa, because we are in Africa, saying that breast cancer is the most common type of cancer in women, affecting about 129,000 women who are newly diagnosed. That's the statistics from 2020. And then in Ghana, where we are, it is estimated that 16,600 cases occur annually in Ghana, which is yielding to an age standardized rate of 109.5 cases per 100,000 persons. So ensuring access to timely diagnosis and appropriate treatment is critical to preventing death from breast cancer, especially in sub-Saharan Africa. So that is a few statistics that we chanced on, and with these we can roll on with this on at the back of our minds. Thank you.
Welcome. God bless you. Do you know what? Sister Christiana Sapon, she's also saying that God bless you, Richmond Media, for this important information. Then she said, thank you very much, Sister Dorcas. So, our viewers and our listeners, you realize that indeed our guest is into the breast family. And look at how she's bringing out the most important thing. So, you realize that currently, breast, as we see it lightly, is now killing a lot of people if we are not able to maintain. So she has done well by giving us the complications people are seeing. If you are not having the effect, someone is also having the problem. So it's good we all know. So if today is your first day of watching Richmo Media health issues, we want you to just subscribe so that whenever we are having health issues like this, you'll be the first person to get it. And also share to your friends, because anyone born to this earth have breasts, and indeed we need to also look at it. Thank you. So Sanakas, you can please continue with how we can perform some self-examination and how we can care for the breast. Thank you.
Okay, thank you, my cherished listeners and viewers. I hope we are. Don't change the link. Don't go and do anything. We are coming to a crucial topic: how to examine our breast, how to care for the breast. And so, please stay tuned as we continue our learning. So, self care. How do you self care for the breast? You have to perform monthly breast self examination. That is for you, the individual. You have the breast, you own the breast. It is part of your body. You have to examine your breast and then detect if there's any abnormality, know the density of your breast, wear comfortable bra, especially the women with large breasts. Put on braziers that will make you very comfortable. Maintain a healthy weight, because you're going to learn some of the risk factors of breast cancer. And then exercise regularly, because it's also going to help you maintain your health in general, as well as you maintain the health of your breast. Then we eat balanced diets, because when you eat balanced diet, it helps you maintain a good weight. You're able to control yourself, your veins and ducts are active, everything is patent, and so your health is good. Okay, so we are going to learn how to examine the breasts ourselves. And breast examination is mostly conducted for the women 7 to 10 days after your menstrual period. Then the men, you take a day in the month, which is constant, that you would examine your breasts to see. It's ideal that it is done 7 to 10 days away from your menses, because during menstruation, during ovulation in the women, the breast changes. During pregnancy, we can notice some changes such as pain in the breast. Sometimes the nipple become very sensitive. Sometimes the breast become heavy. And so when you examine it during that time, you will not detect, or you may not be able to identify some of these key things. So it is ideal 7 to 10 days of your menses. After your menses, you examine yourself. Postmenopausal people who do not menstruate anymore, and the men, you select a day on your calendar, and then you do this self breast examination. So first, you stand in front of a mirror. This can be done in the shower, in front of a mirror, while standing, while sitting, while lying down. So whichever position that is comfortable for you, you use it. So you look into the mirror, because you have to look at the shape, the size, the color of the breast. So while standing in front of the mirror, You take, you have to be naked. You take off your clothes and then you raise your hands and then you check. How is it? When you raise your hands, usually the gravity pulls the breast up, and so you can see both breasts well. Then you see as any bigger as you raise it, does any place pull back? Okay. Then you put your hand on your waist, put a little pressure on it, and then as we said earlier, just to identify the size, the shape with different positions to see how the breast moves. Now, before you start examining the breasts, we use three fingers, the three fingers. You put one hand at the back of your head and you use the other hand to examine the breasts. So the hand behind, so if you are examining the right breast, then the right hand goes behind your head, and then the left hand does the examination. And you do it in a circular motion, continuous, so that you do not miss any part. And so it's ideal, or sometimes when you have a large breast, obviously you may be tempted to move your hand. So you can divide the breast into four. That's four quadrants. And so you palpate from your neck down in a circular motion, as we said with the palm. We have the medium palpation, the mild, and then you add a little pressure while you go round under the breasts. You go round till you get to the areola. The areola is the dark part of your breasts. And then you squeeze on the nipple to see if there will be any discharge. Okay, if there's a discharge, how is the color of the discharge? Um, did you feel any lump? Does the breast have any changes, such as the orange peel? You know how the lemon or the orange skin is. Are there ducts? Are there obvious ducts or pimples on the breasts? Then you pay attention to such things. When you are done with this particular breast, you move to the second one. So you are going to change the hand. So now you are moving the left hand to the back of your head and using your right hand for the examination. You do the same thing in a circular motion or into four quadrants. Examine each side, going under the armpits because it has lymph nodes which are connected to the breast. And then if there's any infection or there's any cancer developing, it can be seen or detected. There's going to be inflammation under the armpit in the lymph nodes. So you do see looking out for the discharge, the pain, the discoloration of the nipple or the breasts. And that is it. So when you do this constantly every month, if there's any change, trust me, you are going to be the first to identify before your health worker sees it. Are we okay with the self-breast examination? I trust we can all do this on our own, either sitting, standing, or lying down.
Yes, yes. Dorcas, do you know something? Do you know most men, if not today, don't also know that men also need to assess our breast?
Yes, most of the time men do not examine themselves. They think the women
Yes,
have the breast. But Mr. George, most of the time when men develop breast cancer, they are not able to identify it because their breasts do not undergo these changes every
that
month. And so they do not pay attention to their breasts. As we speak, I have about two clients who are men dealing with breast cancer in Ghana, in the Volta region here. So it's ideal. My men, please examine yourself. And when you detect anything, it is not normal. Please seek for medical advice. Thank you.
thank you. So, viewers and listeners, you've known that you cannot just go and stand. You see, when you were describing it, you see, I've seen some women. when they visit a facility and you ask them to demonstrate how they were doing their self breast examination, they are just touching where they see. But today you have enlightened us to know that your breast don't end on your chest, but you need to go to your armpit, and that's where it extends from. Sister Christiana Sapon said that please repeat the self examination for her. So that's she wants you to go again with the self breast examination. So Sister Christiana Sapon, don't worry, she will just take us through. You see, she's specialist in breast, so definitely she will make it simple for us again. So I think she escaped or she skipped one point. If you can clarify that for her, thank you.
Okay, thank you, Madam Christiana. I'm enlightened and I'm happy that you are following and we are ready to learn. So, as I said earlier, it is ideal to take a day in the month from the 7th day to the 10th day post menses, or a day, a neutral day for postmenopausal and then the men. So, before you examine yourself, you stand without clothes in front of the mirror. You put your hand on your waist, you raise your hands up to see the shape, the size, the color of the breast. Is there any part that is pulling in, or is there any discoloration, or is the breast looking like the orange peel? So these are some of the things you look out for. Then you use 3 fingers, ideally 3 of the palm. And then if you have a large breast, you can divide it into 4 quadrants. And then you examine each quadrant, each part as you go without lifting the hand. But those who have an ample sized breast, you can go in a circular motion from the clavicle. That is some people call it a Rollins chain. You move in a circular motion under the armpits, under the breast, till you reach the tip of the breast, which is the areola and the nipple. Then you squeeze gently on the breast to see if there's any discharge. You note the color of the discharge. While palpating, did you feel any lump? Was there pain anywhere? And these are some of the things that you notify your health worker when you notice anything. Thank you.
Thank you. So as we are ongoing, if anyone have a question or suggestion, when you drop it, we will see it and also ask on your behalf. Please, how can you help us to be able to know how important diet and exercise can play a role in maintaining the health of the breast? Thank you.
Okay, thank you. We are on nutrition, which is a very important thing to talk about. So, nutrition, do we just eat anything we feel like, or whatever you feel for, you eat it? It is important to maintain a good dietary habit by eating a lot of fruits and vegetables. When you eat them, doesn't mean you are a vegetarian. Okay, we are going to learn other things, but it's important to eat fruits and vegetables. Add them to your meals. If you are eating rice, you can add vegetables to your rice or whatever. Prepare vegetable stews. That is how you can combine it with your food. Then the whole grains, that is the millets, the wheats, all the whole grains, you try to add it. So sometimes instead of cooking just corn dough and cassava dough, you can add millet or sorghum to your cassava dough, and then you get a very good whole meal. Then it's encouraged to take lean proteins. Lean proteins. There are a lot of junk foods around, but it's ideal. And we say protein-rich foods that are low in fat. These are lean proteins. They are low in fat and calories and cholesterol. Most of us hardly check our cholesterol levels, but when we take lean proteins, think it's going to help reduce our cholesterol. And then they also provide essential amino acids for muscle growth and then repair of the overall health. Now, some of these lean proteins include chicken breasts, okay, fish, then lamb. Then when we go to the egg, we have the white eggs. So it isn't always that you have to take the yolk. Sometimes it's ideal to take just the white egg. We have the Greek yogurt. The vegans can also go for mushrooms and legumes. Okay. Then healthy fat foods. Pork is also a healthy fat food. And then sometimes you don't always use oil to cook. You have to regulate how we add oil and fat to our diets. Yeah. So briefly, that is um, the nutrition aspect of health. When you go to exercise, it's not just about going to the gym. There's no gym. We're talking about gym. You can exercise in your room, at the comfort of your home, wherever you find yourself, you exercise. Aerobic exercise in your room. As you play music, you can dance to it. It's all part of exercising. Then flexible exercise. Some people just sit at one place and that is it. Sometimes try to squat in your room. Squat. It will strengthen your muscles. Taking brisk walks, especially in the evening after taking your fufu. Like today is Sunday, I'm sure most people are going to eat the fufu and the banku. Take a walk. It would help you sweat a little, burn a little fat, and it's all part of the exercise. Then regular physical activities. Let's not try the sedentary lifestyle. You are sitting in your shop and someone comes, I'll buy those. You just pick them, or you have shop attendants who are moving, picking the things. Let's move. As you move, they are all forms of physical activity. And so these also helps us to exercise ourselves.
Thank you very, very much. So you realize that as you were mentioning about the exercise, I realized someone was saying that, when you said stand in the mirror, look at your breast, and either your nipple is even inverted or protruded. I hope that's true. Hello?
Hello.
Saraka. So as they asked the person to be exercising, she was pregnant. So they said exercise your breast well so that the inversion can be able to help. Then this exercise there, what can I do? What can I? But as you are taking us through, the midwives were able to direct and guide that individual so that aside all these exercise, know that we have breast exercise. So, beloved, not just that you are going for muscle strength, so you want to just go to the gym, as he's saying, but we have breast exercise that we all need to. Thank you for that in-depth and message for us. So, we want to continue how we can do some screenings there. At what times can we be doing the screenings of our breast? Thank you.
Okay, thank you. So it's ideal to screen. Without screening, without examining, you cannot detect any deviation from normal. And aside our self breast examination that we do ourselves, it is ideal that annually, at least once a year, you go to the health provider for the clinical breast examination. And from the age of 20 upwards, it's ideal. By then, every part of the breast is well developed and well functioning. Then we have the annual mammogram, which is ideal from 35 years for those who have high risk, the risk of getting breast cancer, and then 40 years and above for any features of the breast under the mammogram. Then we have breast density evaluation. Breast density doesn't mean that you have a big breast and so that is a density. No. Some people have cute or small breasts, but then the density is heavy. some are very thick. So it is ideal you go to your service provider and then you evaluate the density of your breast. And this can be done from 30 years. Yeah, from 30 years.
Yeah, can you hear me?
Yes, I can hear you.
Yeah, there was a wide wind blowing, and you can see it's pink man. So all over there is laughing because we are talking about the favorite month and the breast. So the wind is blowing, and I think there was some network challenge, but we're able to hear you. If you can go to help us through how we can care for the breast. I think here is a delicate part, and here is one of the most important part why we have this lesson. And viewers and our listeners, our guest has been able to will take us through from the stage to stage on how we can care for our breast from when you are not pregnant till you reach your menopausal stage. So at this point, you can take your paper and pen. You can call your friend that if he's still online or he has quit, then you let the person know that you have reached the important part. So please, can you kindly take us through how we can care for the breast from puberty. So we realize that we don't have breasts again. Thank you.
Thank you. Of course, you're always going to have our breast intact once we are able to pay attention to some of these things. So during puberty, having an 8-year-old who is already started developing parts of the breast, those days they would have used the banku paddle to smash it because you are too young to develop breasts. But this modern era, we are going to learn how you can care for this breast even at this tender age. So let's pay attention. Puberty, 11 to 18 years. You can develop breast. As I said, I have an 8-year-old who is already developing breast. So they would already start their examination from that age. But statistics or data gave us from 11 to 18 for puberty. So when you start developing breasts, you have to put on comfortable braziers. The brazier should be comfortable. It should be well fitting. Shouldn't be too small. It shouldn't be too large. Just comfortable for you. And sometimes you put on braziers which have those metals protruding. Okay, and it makes it uncomfortable. It may actually be fitting, but the pins, as you're walking, you're pressing, you're trying to push it because it's making you uncomfortable. So why don't you just get a good and a comfortable brazier while you have started developing your breast and you want to make it presentable or well packaged in your dress? Then we have to practice good hygiene. Good hygiene. Some people would buy a black bra, and trust me, the whole month it is not washed because you do not see the dirt on it. This is dangerous because we are not only talking about breast cancer now, but we are also talking about breast hygiene, breast care. We have other conditions of the breasts. You can develop infections. That doesn't mean it's cancer, but they are infections. And once there is dirt, which enters the duct, as we said, it contains glands, it contains nerves, it contains the areola, it contains the lobes and all that. Infection can affect any part of this, and it's very uncomfortable. So we have to maintain and practice good hygiene. Then avoid tight clothing that irritates the breasts. It's ideal to put on cotton dresses. Some people, if you want to go the no bra day, it's ideal you put on a dress that does not irritate the breasts. Okay. Then we have to learn the breast self examination technique as we have already learned it. You wouldn't say that I only have a bad on my chest and so I'm not going to examine it. Or the breast is just as cute as anything and so I'm not going to examine it. It is ideal once you start developing your breasts, you know your breast for yourself and then conduct the self breast examination. Then You also have to consult a healthcare provider for any concerns. Is it that you feel the breast is not developing, or it is overly developed or underly developed? See your healthcare provider. Don't say I'm young and so I'm not, like it's nothing. No, it's something. As young as you may be, you may also develop breast conditions. Yes. So at puberty, these are some of the things we can take note of. When we go through
Okay,
young
we can
adults,
continue.
so adolescents, young adults, 19 to 30 years, as we have categorized, you continue your self breast examination, okay? Because by now the breast is well developed. We learned earlier that um, the breast of the female is fully developed by puberty in most of the people. And so, as a young adult, continue examining your breast monthly and then get familiar with the breast density. Get familiar with the breast density. We've already spoken about the density of the breast, and then maintain a healthy weight, because obesity is a risk factor for breast cancer. Then your regular exercises, you have to limit alcohol consumption. Limit alcohol consumption because they put you at risk. Then you have to consider your health screening, your clinical breast examination that you do in the hospital at least once every year. As we are in October, you get a day, you work with your service provider and tell them, I want to examine or have a clinical breast examination. It will be done for you at no cost in any hospital, in any health facility. Okay. Okay. So adulthood, from 35 to 40, you have to continue your annual breast clinical breast examination. Then this is where the mammogram comes in. It gives another clearer picture. Aside the breast scan, mammogram is ideal. Then you maintain a healthy lifestyle. Monitor the breast changes. Monitor the breast changes, especially during menstrual cycles. Pay attention to it. Sometimes people come to the hospital or they come to complain. It looks like my breast is heavy. No, it's either you are menstruating or you are ovulating. So pay attention to the breast. Then you have to consider your density evaluation. As we spoke earlier, you have to assess your density evaluation of the breasts. Okay, so during pregnancy, someone says during pregnancy already the breast is heavy and I'm awaiting my baby. Yes, your bundle of joy has to suckle, and so it is ideal you care for your breasts during this period. It is ideal. Put on supporting braziers, because your braziers during the normal days may not fit anymore, and so get well supporting braziers. Then you monitor the changes of the breast. As we speak, we have a client who is pregnant and has been diagnosed of breast cancer. Okay, so it can happen at any time. Once you examine yourself, you can detect it. Then you practice the self breast examination as we spoke earlier. Don't say I'm pregnant, the breast is paining me, it is tender, and so I'm not going to touch it. Touch your breast, it is yours, it is part of your body. Then attend your prenatal checkups, because you may not be able to detect, but when your service provider sees it, should be able to identify any deviation from normal. Then also discuss health concerns with your care provider. Yeah. Then during breastfeeding, how do we care for the breast? You know, during breastfeeding, you are lactating, and so there's breast milk everywhere. So you have to maintain a proper hygiene. Okay. Then learn how to latch your baby to breast to feed well. Sometimes, especially for the new mothers who do not know how to position their babies to breast, you notice you would develop cracked nipples. The nipples become sore, and when you are breastfeeding, it's very painful. So you have to learn it. That's why it is ideal that during pregnancy, you go for your prenatal checkups. You attend your pregnancy schools where you are advantaged to learn some of these things. Okay. And then you have to monitor signs of infection, such as mastitis. Sometimes you may develop engorged breasts because your baby may not be feeding well or you are producing a lot of milk. But mastitis is an infection, is an inflammation of the breast. It is painful, your breast becomes hot, you feel sick. You look out for some of these infections. Then you wear Nessun bra. We have Nessun braziers and we have the normal braziers. The Nessun brothers have clips that you are able to breastfeed with ease instead of now going to take it out all over. So we have the breastfeeding braziers that or the Nessun bra. It's ideal. Then we should try to frequently feed our babies to prevent engorgement. Engorgement is when the breast is so full, it becomes so heavy, it becomes so painful if you do not feed your baby. So when you are breastfeeding, please feed your baby. When your baby is sleeping, sometimes you have lazy babies who sleep. They sleep a lot. So you have to wake them up and feed them so that your breast doesn't get engorged. And then also, you report to your health provider if you find any deviation. Okay. Now, postpartum, after breastfeeding, after your child is 2 years and you are done breastfeeding, you have to gradually transition to the regular bra. As I said, we have the nursing or the breastfeeding bra. So you change to the normal bras. Yes. You monitor your breast changes. How is the breast looking? Has it discolored? Is there any lump? Is there any ulceration anywhere? Then you report. And then you continue the breast self-examination. Then schedule your postpartum checkup. Some people say, "Oh, I'm done breastfeeding, I'm okay, there's nothing wrong with me." No, you have to just schedule it. Schedule it. Or if you are not scheduled, you can just walk in. We have some clinics, the wellness clinics. Just walk in. You want to check your wellness, you want to do some labs, you want to assess healthcare, check your blood pressure, your weight at no charge. Okay. Then you discuss breast health concerns. It is here because we are always at your doorsteps. You are always available to hear you. Sometimes, the breast is a very delicate part of the body, and so people do not like talking about it. But you see, through from puberty to postpartum menopause, it is ideal. Don't feel shy. Don't think it is normal. Discuss it with your health provider. Okay.
God bless you. Thank you for the in depth. So you realize that if you are a viewer and a listener, and you are able to take yourself, your daughter, husbands, as you are also learning this, train your daughters. Don't leave that work only to the women. If you're able to start from the puberty time, by the time the person is growing, keeping on growing, there's no way that breast cancer can escape, because as he's saying, don't assume. That's a key word. You see that there have been some change, then you are assuming. Then, oh, it might be like I'm fair, that's why my breast is becoming fair. Or I'm dark, that's why my breast is becoming darker. No, any changes, either good or bad, visit the hospital or visit the wellness center. When you go to the hospital, they are there because we don't ask. When you go, they are there and they can be able to assess for you. Thank you very, very much. Now we want to, someone did not know this. and now the breast is becoming some way. What are some of the warning signs that might suggest that either the person is getting the inflammatory cancer or whatever, that we want to create awareness so that even if your time of checking is not due, but you sense some of these early signs, you just walk through the professionals to take you through. Thank you.
Okay, thank you. Thank you, our cherished listeners
But
and viewers. I hope
before you
you
go in,
enjoyed.
Sister, someone is saying that watching you live from home, great insight from Sister Dorcas, our senior midwife, Etonam Alba. So that's for you. You can continue.
Okay, thank you. So we want to take note of some of the signs and symptoms that may present. These are some of the early signs that one can detect. Once you are able to self-examine and then you go for your annual breast screenings. Okay, so one of the first things you may see, even though we said with the statistics that about 8 to 5% of people diagnosed with breast cancer do not present with symptoms, but trust me, when you pay attention to your breast, you would notice a few changes. Okay, so the first one is feeling of lump or thickness in the breast. It can be a small lump, but don't make light of it. It may be very light, or you feel that a part of the breast has become thickened. As Mr. Akun said earlier, don't say I am dark and so that is why the breast is becoming dark, or I am gaining weight and so the breast has become heavier. No, you have to pay attention to it. Then change in the size or shape. Change in the size or shape. You know, naturally, one breast is bigger than the other, but the margin is not huge. And when you see that the size of one breast is abnormally bigger or smaller than the other, you have to pay attention to this. Okay. Then dimpling or puckering of the breast. Dimpling is just like those who have the dimple. You see that a portion of the breast is going in. Please pay attention to some of the signs. Then redness or scaling. You would say, oh, I'm becoming fair, or the breast is becoming fair. No. Once the discoloration of the breasts, it is an early warning sign that we have to pay attention to. And then sometimes we shed skin, sometimes. But when you notice it on your breast, don't assume. Don't assume. Please visit your service provider. Then the nipple changes. Your areola, that is the larger dark side of the breast, as we learned earlier, it should correspond with the color of your skin. So if you are dark, you naturally have a dark areola. If you are fair, you naturally have a fair areola. But when you notice there's any discoloration which does not match with your skin color, then you have to pay attention to it, to the nipple or the areola. Then there could either be pain or tenderness. As I said earlier, during menstruation or ovulation, sometimes we have pain in the breast for the women. And so, any other day, please present some of the signs if any is noticed. Okay, so these are a few of the signs and symptoms, the early warning signs that you could detect on your breast.
Thank you. So, viewers, listeners, whenever you see some of these changes, we are not saying that you have cancer. No, but we are saying that it's an abnormality you have detected. So, you need to prove further so that a professional will help you, guide you to detect either it's normal or an abnormality, because we want you to have a healthy breast so that we can also enjoy the healthiness of the breast. Okay, what are some of the risk factors that can cause breast cancer?
Okay, thank you. As we said, everybody is at risk. Once you have a breast, you are at risk of having breast cancer. You are at risk of having any breast infection. And trust me, everybody has breasts. Everybody has breasts. Okay. But then there are some things that predisposes or puts you at a higher risk of getting this. That doesn't mean you should get scared. No, trust me. There are some people who have some of this risk but do not have breast cancer. So it is just for you to send your mind to it so that you can detect anything early and then have accurate diagnosis and also get your treatment to prevent death. Okay. So the first on the list is the family history. Family history doesn't mean that your great grandfather's brother's sister had breast cancer and so no. We are talking about the first degree relative, which include your mother, your father, your sister, your daughter. These are your first degree relatives. So if your mother, your sister, your father was ever diagnosed with breast cancer, any type of it, then you are at a higher risk. And so you need to pay attention to the breasts. Then the genetic mutations, and these are common with the BRCA1, BRCA2 types. Okay, these are genetic mutations which are detected in the hospital. So you can just go to the hospital that you want to check, do some labs on the breast, that's the genetic tests, and then you see if you have these. Then personal history. Some people do not have any family member with a breast condition, breast cancer, but personally you've ever been diagnosed with breast cancer. It could either be a lobular one, which is just a lobe, or a ductal carcinoma, which you had surgery and it's been taken off. You still have the risk of it occurring again. Okay, so that is with your personal history. Then we talk about age. We took statistics earlier and we noticed that it can happen to anybody at any age, but the risk increases with age. So the more you age, the older you get, you are at a higher risk of developing breast cancer. Okay. Then um how dense your breast is, because when you have a dense breast, you cannot examine it. It's very thick, and so you may not be able to detect some of the lumps or some of the things. So you need the mammogram or the breast scans to also help you out. Then the hormone replacement therapy, mostly common with menopausal women. But as young as you may be, some people have early menopause. You may be 30, you may be 35, you may be put on hormone therapy. Maybe you have menstrual issues and so you are put on hormonal drugs to help you regulate it. So these also put, in as much as you are saving something, you are also at risk as another thing. That doesn't mean you shouldn't take your medications. Okay. Then obesity, it puts you at a higher risk. And so we learned about our nutrition, we learned about exercise, so that we are able to control our body mass indexes. Then excessive alcohol consumption, mostly to our youth. Excessive alcohol consumption, let's limit it because it puts you at risk. Then we are also talking about reproductive factors. Those days, our mothers, by the age of 15, 18, they have delivered their first child. But because of education, we sometimes wait 35, we are not having our first child. This puts us at risk. Or some people do not, so inability to breastfeed also puts you at risk. The reason is that estrogen, which is a part of the female system, okay, too much exposure of it can cause it predisposes you to breast cancer because you have too much estrogen. During breastfeeding, estrogen is suppressed. Okay, during breastfeeding, estrogen is suppressed. But if you do not breastfeed for estrogen to be suppressed and prolactin comes in, so during that period, the estrogen is still active, and so it predisposes you to it. Then also we are talking about people who are having their first children, as we said earlier, after 35 years, after 40 years. It may not be their fault, but we are not saying that you will get breast cancer. No, we are just saying that you are at risk. So we encourage our mothers to exclusively breastfeed the babies for the first 6 months and at least continuously to 1.5 years or 2 years. Because of career, we do not exclusively breastfeed, and we are predisposing ourselves. We are putting ourselves at a higher risk. And then by the time the child is 1 year, we have weaned the child of breast milk. Trust me, mothers, my ladies out there, breastfeeding your child up to at least 2 years gives you that protection. Okay, and so let's try as well to breastfeed our babies. Okay, all right.
Thank you very much. I like the stressed point. Don't think that as you are aging, you get breast, you have breast cancer. No, but we are saying that when we are comparing two groups of people, that's what Dorcas is telling us. When we are doing comparison and you fall within this category, it means that if you have a family history of that compared to someone who is not having the family history, you are at higher risk than that individual. So don't be scared. Now I have some things for you. We have Mr. Richard K. Apple said that right from Biakwe DHG. I'm enjoying the show. The first vice chair for JRNMA Kwando. You are right on point. Keep on doing what you do good. And Sister Felicia also said kudos, Sister Doki. So these are what others are also watching and the recommendations they are bringing. Okay, so I think you wanted to let our viewers know some of the images of the symptoms you talked about.
Yes. Okay. Thank you for your comments. Keep bringing your comments up. We are loving it. Thanks for the encouragement. So, our cherished viewers, our listeners all over the world, we spoke about some of the signs that you can see. Okay, so we are using the lemon to demonstrate or to give us a view so that it wouldn't be an abstract knowledge, but you can also see what we are talking about. So we have the changes in the breasts, the dimpling, the discoloration, um, the lumps, and all these. I'm sure the recording will be online, and so if you missed this part, please go back and then have a look at it so that you wouldn't have just an abstract imagination of it, but you can have a pictorial evidence or something to look out for. Okay, so types of breast cancer. Um, we are creating awareness on breast cancer in as much as we are talking
Yeah.
about the general health of the breasts. The general health of the breasts. Let us just go through a few points to note. Types. The types. Okay. So we have the inflammatory breast cancer. Inflammation is when your body is responding to any infection or any disease. That's inflammation. We have the lobular breast cancer, which affects just a lobe. So we saw the development of the breast earlier. You saw that the breast is developed into lobes. Okay, so it can affect just a lobe of the breast. It can also affect the ducts. The ducts. So it's like a tube. The tubes that connect to the nipple where you are able to breastfeed, where they are able to secrete any discharge is noticed. Okay, then also we have the Paget's disease of the nipple. Okay, all these are types of breast cancer, but until you go to your service provider, you wouldn't know what type. Seeing a lump in your breast doesn't mean you have breast cancer. Okay, seeing a lump in your breast, feeling pain in your breast doesn't mean you have breast cancer, but it is ideal that you investigate further. Yeah. Okay. Okay. So calling to action. After all has been said and done, what are you taking home? What are you telling your sister? What are you telling your brother? Your mother sitting at home? To yourself, what are we doing? Consult your healthcare provider for personalized advice. Don't just assume. Don't assume. Don't self-diagnose because you may misdiagnose, underdiagnose, or overly diagnose. So consult your healthcare provider. Never assume. Then another thing is one is encouraged to prioritize breast health. It is one thing that we do not pay attention to. We don't. Like you put on your bra, you're good to go, you're looking cute, or the gentleman. Like some people have well-built bodies and so they make sure of it. No, prioritize your breast health. Self-examine yourself, pay attention to yourself, know your breasts, know what you have. It might have been falling, it might stand. However it is, we have different shapes. You may have the orange shape, the purple shape, whichever. Pay attention to it, prioritize it. Then we're also talking about prioritizing stress management. Stress. How well do you manage your stress? Do you flare out? Do you stay calm? All these are being controlled by our hormones. And so you manage your stress well. And as we hashtagged earlier, it is still remember that early detection saves lives. So when I say early detection, you say what? Saves lives. When you see your friend in your pragya, in the taxi, in the Uber, wherever you see your friend at work, just remind them, tell them, use the slogan, early detection saves lives. I can't hear you. Early detection saves lives. Take your neighbor in your room, wherever you are, tell your friend, early detection saves lives. Thank you. Okay, there's a comment in the section, can breastfeeding prevent breast cancer in the breast? And then can men also have cancer of the breast? Yes, yes. Men can also develop breast cancer because as we speak, there's a client with breast cancer in my municipality who is being worked on, who is a man. Okay, and then you are saying breastfeeding does not totally eradicate it, but um, it's breastfeeding does not eradicate breast cancer, but it also reduces your risk because during breastfeeding, the hormone estrogen is suppressed, and so you will have a lower risk at the time. Yeah, thank you.
Okay, thank you very much, very much. Thank you, thank you. I hope you've answered the question. And Mr. Okanse is also saying that wonderful presentation. Then Sister Jacqueline is saying that early detection saves lives. Then she also continued to say, well done. So thank you very much. You have really helped us. Someone is asking, as you talked about hygiene, can we apply pomade and things on our breasts? Thank you. That's a question that has come on, but the first question, I will continue after answering the person.
Okay, so can you apply pomade to your breasts? Is the breast part of your body? If it is, then once you are pomading yourself, you might as well pomade your breast. But then let's be careful of the kind of chemicals we apply. Some people want bigger breasts, others want smaller breasts, and so they apply chemicals. Or you see that some people want to expose their breast, and so they apply oil, certain essential things to enhance it. That is when the problem is. But it is very normal that the pomade you apply on your body is applied on the breast. But let's be careful of the chemicals that we introduce to it. Thank you.
Another question that someone has sent is that an individual or some women also like tattooing their breast. How can you advise that those individuals that this has a linkage affecting the breast health? Thank you.
Okay. Thank you. I want to give a shout out to Mr. Okanse. He's the latest oncology nurse specialist who graduated from the Ghana College of Nursing and Midwifery. His graduation was just a few weeks ago. And so I'm happy he's my coach, he's my mentor, and I'm glad he's here with us, as well as
Okay,
I
then
acknowledge
Mr.
other.
Okanse, congratulations. I hope Mr.
Okay.
Okanse, congratulations. Yeah.
Okay, so
So you can please
um
answer the tattooing part.
all right. Tattooing the breast. When we're learning the anatomy of the breast, we notice that the breast contains glands, it contains nerves. Okay, so when you are tattooing, you do not know um, um, the metals that are used to write, your chemicals that are used, and all these predispose because every nerve, every blood vessel, every duct, it leads to another blood vessel. And so when all these are introduced, you may not get breast cancer, but you may get another form of cancer, which may predispose you to breast cancer. So let's desist from it. It's not ideal. Why do you want to tattoo your breast? Yes, to beautify it, to enhance your body, but then let's pay critical attention to our breasts.
Thank you. So since when you're mentioning the types of breast cancers, you talk about the inflammatory aspect. So our viewer, as she has said, anything that you do, either the pin, the ink, or anything, can also cause the inflammatory response, which will initiate the breast cancer or any other breast issues. Because we are talking about breast health, of which cancer is part, and other illness also are also part. Messia Taylor said, God bless you for your time. So, Sister Dorcas, we want to end this wonderful presentation. I hope our viewers don't want us to go, but since we are dealing with time, what is your take home message for our viewers and our listeners? Thank you.
Okay, thank you. Our viewers, our cherished viewers, our listeners, we appreciate your time to get educated as you create awareness in the month of October on breast cancer. Let's know our breast. Let's feel the breast. Let's examine it. Talk to your health provider. Maintain a good health. Maintaining a good health doesn't only mean that you are paying attention to only the breast, but our diet, our exercises, having our regular checkups also helps us detect some of these deviations. And don't forget that early detection, early diagnosing, and accurate treatment always saves lives. So, as we always say, the hashtag early detection saves lives. Thank you all for making our time to listen, to learn. We appreciate you all. Thank you, Rachel Media. Thank you, my host, Mr. George Ackon. Thank you, my family, for the support, my mentors. Shout out to all my Jeremy members. I'm grateful for your time. Thank you.
Okay, Vice Chair, thank you. For upon all your busy schedules, you have made time for us. Our viewers and our listeners across the globe have enjoyed the presentation, and God bless you for your patience being with us. So, until then, same time next week, Richmond Media Health Issues will come to your doorstep. So, thank you. God bless you, Sister Dorcas. We can't stop thanking you for this in depth knowledge. So we will meet again next week on Richmond Media Health Issues.